Dr. Dhaliwal was the president and CEO of Cancer Care Manitoba for 10 years. Dr. Dhaliwal has been instrumental in the initiative to re-engineer the patient journey. One of his concerns was that the length of time between suspicion of cancer and diagnosis was much too long, causing stress, worry, disturbing sleep, and significantly affecting a patient's daily life.
There's a very important outcome that I believe we need to pay a lot more attention to, and that's the patient's need to resolve that uncertainty. When a suspicion of cancer is raised, most patients are in shock and their life is put on hold until that uncertainty is resolved. When you put it all together, the journey from high suspicion of cancer to start of treatment can be inordinately long as I'm afraid to say 3 to 9 months. And clearly this is an issue for system managers like myself and physicians like myself. Obviously, the patient's need is what should dictate. We set out to try to look at the problem as a whole, and many other cancer agencies have focused on components of that journey, the time when you're ready to receive radiation to the start of the treatment, because the planning can take time. We're really interested on the beginning of the journey to the start of effective treatment. And once that is confirmed, then the patient becomes a cancer patient or patient with a cancer diagnosis. And that really increases, as you can imagine, the psychological temperature incredibly, and anxiety and worry. People cannot sleep, they cannot eat, they can't enjoy social events and so on, and will cancel holidays and weddings and all sorts of things because of the worry that this disease may progress. And we know that the earlier you treat in terms of the stage, the better the outcome. Is in a way the imperative that should drive all healthcare workers, physicians, nurses, clerks, frontline staff, to try to resolve that uncertainty as rapidly as we can.
Through a combined effort of the regional health authorities, government, physicians, and specialists, it was agreed to a collective effort to shorten the patient journey.
And so we proposed a project that would aim to reduce that journey to less than 60 days for all patients. And I believe it can be achieved through coordinated actions of all care providers. Cancer Care Manitoba Foundation does a lot of risk awareness, and we haven't talked about that aspect, which is trying to reduce our risks of cancer, because we don't want to be diagnosing and treating cancer. Ultimately, the real effort is trying to prevent and detect cancer early. So we have screening programs, and still not all people make use of it. And so it's a challenge. There are many challenges. I'd particularly like to emphasize that there is much that all of us individually and collectively positively can do to reduce the risk of cancer. Take exercise. There is new and emerging evidence that it can reduce the risk of developing cancer by 30%. 30%. If we had a pill that did this and it cost thousands of dollars, we'd all be screaming for that pill. And yet, it is something that is within our control. So I would literally urge every Manitoban to be as active as they can. And it'd be wonderful to say Manitoba has the most highly active population in the country.
That would make you happy.
Yes, that would be absolutely wonderful.
You must look back on this initiative to shorten the patient journey and feel a sense of pride. It's such a significant impact.
We have yet to achieve that target, but to have been part of the solution and part of at least the energy to begin that transformation is a privilege.